think that the conversations are really important windows in what can be, at least in my mind. And we certainly appreciate that there's quite substantial focus and interest in seeing what can be feasible for Zambia. Besides what Dr. Makasa has talked about, I think a big challenge for us, we have many challenges, but an enduring challenge at the moment with the lens of universal health coverage is how do we provide the very basic of cover for the children and the women out there in the remote sort of areas. And I think that there should be innovative ways to really come up with mechanisms to provide that support. From what we're discussing, and then during break, I was thinking that it is probably an opportunity to look at the gaps that the current health insurance program in Zambia fails to cover. It does provide some minimum cover, and surgical hospitals from the are now able to claim part of that insurance based on the costs that but it is limited. So is it possible to have a program that then bridges that gap, which could be maybe very, very prescriptive as to who would be, what conditions, or who would be eligible to access that support, that is ring-fenced within the insurance mechanism, and that's what, an investment may come in and provide cover for, so that that child or that woman who meets that criteria then accesses that support and gets a full complement of. And I think that would be a win-win situation, starting really with the intended patient themselves going through it, to the hospital and the doctors and the system providing the care, but also to the investors or the donors or partners, whichever the case may be, because then they are not just being catalytic to a process which would otherwise have failed. I think that their intended means are being satisfied. And in terms of the impact, they can objectively quantify that impact and measure it and be able to show that because we invested, this is what is coming out of that investment. So in my mind, I can see a possibility of that. I'm only a professor of vaccinology. I don't know too much about money, but I think that it is possible for these kind of things to happen. We really talking about the solar energy for health facilities. This has been a very, very important component of our conversations in government. Actually, our president has given a directive that we must not have a health facility without running water, without basic lighting, which in rural places has to be solar driven, and a mother-child sort of facility for women to safely deliver in. And that's a very, very strong directive. And thinking about the conversations we are having here, again, to Dr. Makasa's point, the government in Zambia is already taking lead. And by the way, in the constituency development funds that I talked about, they have already given guidelines to insist that where there isn't these facilities, they must get those constituency funds too. But of course, there is a lot of bureaucracy and processing, especially in the more remote areas, to make sure that the patients get this. But there are a lot of opportunities in this space, given what we are discussing here, that we can take advantage of and really have something very quickly to show impact for. I don't know whether this is the right opportunity, but I'll take it anyway and say that in November, end of this year, we are hosting the Continental Public Health Conference. This is the conference on public health in Africa. We are anticipating almost 5,000 delegates from all over Africa and all over the world. And I would like to put it out in this meeting that it would be great to have a side event that then looks at, from World Health Assembly to CFIA, we call it CFIA, what have we achieved, what progress have we made? And so it's an open invitation. Thank you.